Gonna feel quite nice. Yes, you can open your mouth, there's no problem. And it's actually gonna feel good in your throat. Oh my gosh. Hey, please take a seat. Okay, what can I do for you today? Feeling a little bit under the weather? I'm so sorry to hear that. Okay, I'm gonna help you today. Can I see your number? Thank you. Okay. Very well. Can you tell me what is going on? Your throat hurts? Your ears hurt? What kind of pain are you feeling? Kind of like something is inside there? Okay. And your throat too? Okay. Let's do a full checkup, okay? Don't worry, I'm gonna help you. Let's start with your vitals. When did your throat start hurting? Quite some time, right? Okay. Let's take a peek here. Okay. Breathe in. Breathe out. Okay. A little bit agitated. You think you're running a fever? Okay. We're gonna check that. So when did you start feeling this pain in your ears? At the same time as in your throat? Or before or after? Okay. We have to go step by step, okay? But don't worry. I'm gonna check on that too. Okay, let's see. You do feel warm. Let me put the thermometer. Okay, raise your arm. I'm gonna put your armpit. It's gonna be a little bit cold. I'm sorry. I know you're feeling a little bit warm right now. Okay, there we are. Close your arms. Very well. Let's check that neck. Let's see if it's swollen. Okay, don't worry. Let's see. It is a bit swollen in here. Does it hurt when I press it? A little bit. How about here? Yeah, it does feel tender in this area. Okay, I'm sorry, I'm gonna press a little bit harder. Okay. Let me check your sinus. Do you feel pressure here? Yeah, it's definitely congested. Have you been getting a cough, sneezes, just a tingling in your throat? Okay, don't worry. Let's check the back of your neck. It's gonna tingle a little bit. Okay. Okay, very good. Thank you. Yeah, it's definitely swollen. All the area, the neck area. I'm gonna check your thermometer. Okay. Here we go. Raise your arm. Okay, you're running a slight fever. It's not that high, but we're gonna take care of it, okay? Let's check your pressure. Can I see your arm? Okay, put your hand in here. Like so. Good. Okay, you're gonna feel pressure when I turn it on. Okay, ready? Good. Doing good. Doing great. Perfect. Okay, it's quite right. No problem in there. Gonna check your eyes now. Okay, you're gonna look straight forward to me, please. The light's gonna be very bright, so just so you know, gonna put your eyelid a little bit. Try not to blink when I do this. It's a little bit red. Right now, how are you feeling? Are you feeling tired? Yeah? Have you been sleeping a lot? Quite a bit? Yeah. Okay, we're gonna have to do full examination of your mouth too, okay? Need you to open wide for me. Good, like that. Now let's gonna check in there. Oh, okay. It's very swollen. Your tonsils and the back of your throat too. We're gonna have to do a strep test in a moment. Okay, relax your mouth a little bit. I'm gonna have to take a sample of the back of your throat so I can test it out for strep. Okay, it's gonna be a little bit uncomfortable. I'm gonna be swabbing the back of your throat. Okay, so try not to gag. I know it's hard, but let's do our best. Okay, I'm gonna open wide, please. I'm gonna go deep into your throat. That's gonna be quick. There we go. Just a moment. Let me get my kit. Right here. Okay, we put it in here, and if the water changes color, it says that it's positive for strep. Okay, negative, which is good. Okay, it's definitely very swollen, so it's gonna be a sore throat. I think it's bacterial. I don't think it's a virus because the test came out negative. So I'm gonna give you something for the symptoms, okay? But it's gonna run its course. You're gonna feel tired during this time. I will suggest you to take a day off so you can rest, you can sleep, you can relax and let it go through. And with the medication that I'm gonna prescribe you, it's gonna help you feel better. Okay? Now let's check those ears and know that it's been bothering you. Where is my... Here it is. Okay, so I'm gonna use my otoscope right here so I can check both ears to see what is going on in there. Okay, try not to move while I do this. There is some blockage in your ear. Not quite sure what is blocking the entrance. Doesn't seem like earwax. Something else. Okay, let's see here. to use a different tool. Okay, this tool is a scraper with a light on top. As you can see, it lights up. It's gonna help me take a peek inside your ears and see if I can remove the blockage. Okay, I will be moving ear to ear, but for this I need you to stay really still because I will be peeking right inside and I don't want it to be any problems there. Okay, if you need to move, sneeze or anything, let me know beforehand. Okay, let me just put this on again to protect your clothing. Are you in a comfortable position like this? Maybe you can recline the chair a little bit. Okay. Okay, no problem. This way I can work with it. Don't worry. Just please stay very still while I do this. Well, I was able to remove the blockage. It seems like it was earwax, but it was really hard. It was impacted, as I believe. This happens sometimes when we are prone to use Q-tips to clean our ears. Sometimes we just push the earwax all the way to the back, and with time it gets accumulated and it gets rock solid. So I tried to remove as much as I could, but there is still a lot near your eardrum. This procedure is a little bit more difficult. I wanted to have your permission to do it because it does take a little bit more of time. So if you want to try that, so I can add it to your account. Yeah. Okay. Yeah, because we were just taking place for a regular checkup, but this does take a little bit of more time. Okay, beforehand, I want to try something else. I want to see if you're having some issues with your hearing, because the blockage is pretty extensive. Right now it's completely blocking your eardrums, okay? So I'm gonna use this tool right here that is gonna allow me knowing if you have some ear loss because of the blockage, okay? Let me know if you can hear it. Okay, we're gonna do it again. Barely. Okay. There is a significant hearing loss here, but I don't think it's nothing serious. I believe it's because of the blockage, but we're gonna do this test again once I clean your ears completely, okay? I'm gonna be using drop medication like this one that is gonna allow me soften up a little bit more the earwax. As I was saying, I removed some of the endless earwax. It was pretty harsh, but I was able to do it. I'm gonna be using this, so you know it's gonna be at extra cost, okay? And this is gonna feel a little bit weird on your ears. You're gonna start hearing a kind of sizzling sound, like a frying pan in both your ears. Okay, so just so you're aware of that. Let's start this ear. Now this ear here. Okay, you're gonna start hearing that sound now. Okay, we're gonna wait a couple of minutes while it start acting up, so I can prepare myself. So how are you feeling? Still sizzling? Or is it done? Yeah? Okay, we're gonna let it a little bit more time there. Okay, we're gonna continue with the examination. We have ruled out that what you're feeling right now is a sore throat, bacterial, made by bacterial agents, but there's nothing that we can do besides treating these symptoms, okay? So that's what I'm going to prescribe you. Right now I'm going to give you something for the mild fever that you're running. I don't want you to feel uncomfortable while we are doing the ear cleanup, okay? This is going to feel very fresh on your forehead while I apply it. It's a special liquid that starts feeling very cold in the area that we apply it. It's kind of like a bandana that we apply in the forehead area, so it soothes you a little bit. Are you running a headache too? Slightly? Okay, it's more of the feeling tired, right? Okay, don't worry. I can give you a medication for that at extra cost, of course. Do you want me to have to give it to you? Yeah? Okay. Very good. So I need you to open your mouth. This comes in drops. Stick your tongue out. Okay. Good. It tastes a little bit sour. You okay? Okay. Just pass it on and start feeling better in no time with that. Okay, the bandana is going to start cooling up a little bit with time. So it's going to take us a little while to extract all that debris in your ears. Okay, since we started using the agent that is going to soften up the earwax, I'm also going to be using these tools right here. I'm not going to be sticking this out, usually do it that, but I'm going to be using these little scoops that are behind it. So you can see they are disposable. So I have a bunch of them right here that I'm going to be using, along with my light up scoop and my light up tweezers right here, so I can check inside of your ear and remove any debris that might be there. Okay, so again, same procedure, not moving, try not to be talking during this because it's a very delicate area and we need to be very careful with it. Okay, understood? Very well. If you need anything, let me know. Oh, you can touch my arm, okay? Good. Those are going to be a little bit cold while I insert, but don't worry. After a while, you're not going to feel anything, okay? Very good. before you fall asleep. Okay, let's see. The fever has gone down. Very good. Very good. I'm going to remove this. You're going to wake up in no time. Let's see. Here. It's just still a bit swollen. Okay. Here. You haven't come. How are you feeling? A little bit better? Glad to hear that. Okay. Let me add this to your account. How is that headache going? Not anymore? Huh? Very good. Very, very good. Let's check your throat again. I want to make sure that it's going a little bit down. Okay, open wide. Where's my light? Oh, here it is. Okay. Okay, it's still swollen, but not that red as before. That's good. So you're responding good with the medication. Let's check your temperature. Again, I'm gonna put the thermometer in your armpit. Here we go. It's gonna be cool. And close your arm. Okay, while we do that, we're gonna check your ears again to see if the hearing has been helped a little bit with the removal. Okay. Much better reaction. Very good. That reaction is much, much better. Perfect. That is much, much better. So definitely the problem there was that it was too clogged. And by releasing all of that, actually there was some fluid in there. So that can actually help build up a headache. And can sometimes lead to infection and troubles with the overall health. I'm gonna remove this now. You don't need it anymore. Okay, so what I'm gonna be prescribing to you is a medication for the headaches and the fever. That's gonna help you feel much better. As I was saying, I recommend you to take a break, at least a day off, so you can feel better. For your throat, I'm also going to give you something to help it soothe and not hurting, because I know it can be tingling and hurting sometimes. By the end of the treatment, you may have a little bit of cough. That means that you are in the last stages. And if the cough gets too harsh, you can take some cough medication over the counter, anything that you will like. It will help you with that, but it's gonna let its course, okay? Or you can take honey tea with ginger. It's gonna help you a lot with the cough if it starts, and that is also gonna help you soothe your throat. Okay, let's see that thermometer. Okay, raise your arm. Good. It went down. Perfect. Okay. So, do you have any questions? No? Okay, so I'm gonna send this to the reception. There you can pick up your prescription and your medication. Actually, I'm gonna give you a discount since you got the ear treatment. That is one of our pluses here in the CVS clinic, and it's gonna help you a lot with the cost of this consult. Okay? Any other questions? Good. Well, it was a pleasure. Take care and remember to take the medications. Goodbye. Hey, how are you doing? Yeah, I was just with a patient. I'm gonna be in my break in no time. What do you wanna eat? Okay. Okay, see you. Bye. How are you? Nice meeting you. What can I do for you today? Okay. So you're not feeling well? Oh, okay. You're here just for a checkup. Perfect. Yeah, is there something that is bothering you that you need a checkup? No? Okay. Just for your health. Of course, I understand. Okay, let me prepare myself and I will start with this checkup. Okay. positive, so there's nothing to fear. Okay? So, if you have any doubts, call me and I will give you any advice that you need. Okay? Take care and I'll be calling you 2 days. Okay? Bye-bye. Hi, please take a seat. My name is Dr. Whispers. What's your name? Okay, just let me look you up in the system. Okay, here you are. And what brought you here today? Okay. A few problems with your scalp? What kind of issues you're having? Well, symptoms and what do you feel in general? Okay, I'm gonna type it in your file. Feels dry, itchy. Feels hard to the touch. What do you mean hard? Like patches. Okay. Any other symptoms besides the ones in your scalp? A few headaches. What kind of headaches? Does it hurt right here in the front or the back? Okay. The fever, how high has been? When did the symptoms started? And what made you decide to seek for help now? They got a little worse. A little painful. Okay. Don't worry. I'm gonna help you today. I'm gonna do a full diagnosis and then a treatment. Okay. Any other symptom that you want me to talk? Well, that does count as a symptom, yeah. Feels itchy right in the back. What kind of itchiness? Yeah, it does. It does count. Okay. What were you doing when you started notice the symptoms the first time? Okay. So it's mostly the pain that brought you today? And before that, what were you doing to treat the symptoms? Painkillers? Changing shampoos? And it didn't work? Made it worse. Okay, yeah, I need to type that down. Okay. Very good. What we're gonna do today with you is do a full inspection of your scalp, and we're gonna do a diagnosis to see if I find what is the cause of all those symptoms. Definitely is not something common or normal. A little itchiness is okay. Sometimes it can be caused by dandruff or lice or any other bugs like that, but those are mostly harmless and don't involve pain. But when the scalp itchiness involves pain, there is something wrong in there. So we're gonna take a look into that. And after that, we're gonna do the full treatment if we find the cause. Okay. Let's see. Okay. touch your hair right now. I'm just looking at it. Okay, I don't see signs of dandruff or greasy hair. Okay, I'll tell you what. I'm gonna put on my gloves and I'm gonna do the inspection first. Yeah, I'm gonna go inch by inch with your scalp and your hair. We need to see sometimes these disease or illnesses hide along our hairs. It's kind of hard to find it. So the shampoos didn't work at all. Right where the itchiness. How often do you wash your hair? Okay. And what kind of hair products you use after showering? Okay. So let me start in the front. Are you wearing any hair products? Gel, spray? Clean? Okay. Let's see. Okay, we're starting up in the front. Okay, but sorry if I'm being too quiet, but I don't want to miss anything. If I touch any part and you feel the pain that you were talking, let me know, okay? It's very important. Okay. Yeah, calm. I don't see any signs of dandruff. Sometimes it's the beginning of a disease when it's left untreated for too long. In pretty rare cases it happens. Your hair does feel dry. Even with the gloves I can feel it. A little bit coarse. Is your hair naturally curly, straight? Okay, so do you feel that the texture has changed too? Okay, that definitely isn't normal, so okay. Feels itchy there? Okay. I'm gonna pull a little bit your hair here. I'm sorry. Okay. Yeah. Starting to see a few patches here. Let me get a comb to be able to see better in this area. A little bit worried of this right here. right here in the back. That's the part itchy, and the pain is located right here. Don't worry, I'm not gonna touch it. Just need to see a little bit right in the scalp, but it's a little bit difficult. I'm gonna use a UV light to check on the patches that I found. Okay. Okay. Try not to move while I do this. I know it's gonna be itchy. I'm sorry. I'm gonna scratch a little bit. Okay. Now I'm gonna be in the back, checking all the way, okay? I'm gonna be scratching a little bit harder and pressing a little bit more. So maybe it will get a little bit uncomfortable. I'm sorry, but it's necessary for this test and diagnosis, okay? Just hang on for a little bit. It will take no more than 10 minutes, okay? It's really important. Very good. Let me remove these gloves. It seems that you have a fungal infection in your scalp. It's something that was not treated on time and got a little bit serious. But don't worry, it's still treatable. We can do it right here in the office. And you are also going to take a few medications at home that will help you remove the infection completely. I did a little scraping there, and I'm going to be sending it to the lab, but I'm pretty sure of what it is. So the treatment for you is going to be a scalp wash, complete scalp wash, and we're going to use a cream, fungal cream, that looks like this, and it will help us treat the damaged scalp, especially on the patches that I found around your back, the back of your scalp, where is the itchiness part. Yeah, I know it's hard to look at it, so I understand that you weren't able to look at it and seek help earlier on, because if it was right here in the top, it will be much easier. So I understand that, and don't worry, it's treatable completely, but right now it's a little bit tiny serious, but we're gonna help you with that. And we're gonna go now to the washing station to do a full wash and the treatment. What we're gonna do is use terbinafine, which is this cream, and then a treated shampoo. What this will help us is remove a little bit of the top of those patches, which is the dry part. And it's not gonna hurt because I'm gonna use first the numbing cream on those patches. That is gonna help with the itchiness and the pain that you were feeling. Okay, and after that we're gonna do the treatment shampoo, and you're gonna take home a few samples of it, and also this little fella right here that is gonna work wonders on you. Okay, before we're going, I'm gonna apply the numbing solution. Let me just prep her up because it takes around 5 minutes to start acting. Okay, let me just prep myself and we're gonna be ready to go. Okay, just tied up my hair, put on the gloves, and I'm gonna prepare the solution to put on your patches. Don't worry, it's gonna feel really nice and a little bit cool, and it's gonna completely disappear that pain and itchiness. And after the washing, you're gonna feel like new. Okay, let's prepare it. We're gonna use as a base the still water. And a few drops of our numbing solution, just a little one. There we go, just mix it up. Where is the, okay, here it is. Very good. Okay, so try to stay still while I do this. Okay, I'll be working on this area first. Gonna scratch a little bit. Does feel cool, huh? Really nice sensation. Okay. I'm gonna put a little bit of pressure now. Okay, just let it sit in, and I'm gonna go prepare the washing chair, and I will call for you in a second, okay? Okay. See the water. It needs to be warm for this. Feel good. Very well. Now I'm gonna use the cream first. Wash your hair first. I'm gonna scratch a little bit on the area. You know if it hurts, okay? It's a little bit too soppy. Good, I'm gonna rinse it now. How does it feel? Very cool down, huh? Okay, after this I'm gonna take you to the drying chair with cool air that is gonna dry your hair. Then we're going back to the office, okay? Okay, let's go. Get you the towel. So we clear up that scalp really good. How do you feel? Yeah, I bet. Okay, so the surface of your scalp must be free of the fungal, but there might be still a little bit on the deeper layers of the scalp. So for that, we're gonna use a medication that I'm gonna give you so you can use it at home. It's pretty simple to use. With any type of shampoo that you use, the only difference that you're gonna do is take a little bit of the shampoo, put it in a little container, such as this one, and you're gonna use the drops that I'm gonna give you for the fungal infection, such as this. And all you're gonna do is apply 2 drops to the measurement of shampoo that you regularly use. So 2 drops, and then all you're gonna do is shake it until it's completely mixed up. You can add water if you want, but you're gonna do this for around a minute or so. Then you're gonna apply it, and you're gonna do the normal scalp massage as I did with you earlier on, remember? So you're gonna do that for a minute. It's okay, with a minute is enough. And you're gonna do that, and then you're gonna rinse it completely, okay? After that, when you're finished drying your hair and everything, you are gonna apply this cream with a little massage that I'm gonna do right now. Your hair is not completely dry, as you can feel it, yeah, but it's not damp, wet. So what we're gonna do, I'm gonna show you in a moment. We're gonna get just a little bit, since your hair is a little bit wet yet. So with this, it's enough. You're gonna apply it in your hands. As you can see, it goes all the way to your hands. And then you're gonna start scratching your head with it, especially on the parts that you had the patches, which will be in the back, like so. Don't go with your nails, okay? Just the tip of your fingers, only on that part, only in the patches that you feel right there, right in the back. Can you feel that? Circular movements, but applying a little bit of pressure, like so. Okay, so you're gonna do this for a couple of minutes. So you let the cream be absorbed by your scalp, and you're gonna do this for around for a week. For a week, it's okay. It does feel nice, isn't it? Right now, I'm not using gloves anymore because the infection cannot be transmitted to me anymore. What I would recommend is for you to wash your bed sheets, especially the pillows. Wash your pillows, or you can throw them away because you don't want the infection to return. If you sleep with someone else, you should ask them if they need to have a check. Yeah, it's highly contagious. Like so. Okay. Gonna let that set for a little bit. Gonna clean my hands now. Okay, now I'm gonna do another visual inspection on the area, this time with a different light. And I'm gonna use my little magnifying glass to take a peek in there, okay? Very well, here we go. With this, I'm gonna take a peek closer to look into the patches to see how the dryness looks. Okay. Very good. The redness, it's gone. It has a really beautiful pink color in here. It does look more healthy. Okay, do you feel this area? Do you feel any more pain? Good. How was the itchiness? And you don't have any numbing cream now. It's all your scalp. Okay, no. Doesn't feel that dry anymore. Yeah, with your hair, that will take some time to repair the damage. But there is some commercial shampoos for hair repair that will work great on you. Since you're treating your scalp now, your hair will look better now. Okay. Very nice. Good, 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 good. Very nice. I'm gonna apply a little bit more of the cream, okay? There's a patch I miss here. Right here. Okay, very good. Let me just clean my hands again. You're gonna take this home. This will last you for about a week. I would recommend you to wash your hair every night, okay? Every night for 2 weeks. After that, you can return to your regular hair washing schedule, and that will be fine. And I will want to see you again in 2 weeks time. Yeah. Okay, let me see here in the computer when I have it open. Okay, now it will have to be 3 weeks. Okay, so I need you to follow the instructions, and I will see you in 3 weeks. Do you have any questions? As I was saying, your hair, maybe it wasn't just the fungal infection. I believe maybe you have some damage from a treatment or something like that. I would recommend you to go to a salon and they can help you with that. Yeah, sometimes when the structure of the hair changes, it's because we had something done to it, maybe bleaching, too much heat. Yeah, sometimes it happens, and other times it's because of a scalp infection, scalp problem, but in your case it's because maybe you had a work done on your hair. No, it was my pleasure. If you have any questions or anything, just call us, okay? Oh, of course, it was my pleasure. Take care, okay? And follow the instructions. Okay, bye-bye.